Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Dear students, till now you studied diseases. From today onwards, you will study human beings who have diseases. Clinical medicine will test not only your memory, but your character, patience, and empathy. Mistakes will happen, confusion will come, but every sincere effort will shape you into a better doctor. Remember, a good doctor is not the one who knows everything, but the one who cares deeply. Bismillah ar-Rahman ar-Rahim. Our lecture series on Introduction to Clinical Medicine. The full lectures roadmap with the aim to help newly promoted third-year MBBS students transition smoothly and confidently from pre-clinical learning to real-world clinical practice. To get this aim, this lecture series consists of 8 modules. The first module, entering clinical life, the mindset shift. Then the second module will be on approaching the patient. The third module will be on history taking, the soul of clinical medicine. The fourth module will be on clinical examination, seeing with purpose. The fifth module will be on clinical thinking and reasoning. The sixth module will be on investigations and reports, introductory. The seventh module on ethics, safety, and attitude. The eighth module on becoming a better clinical student. And then a final lecture. So my request to you will be that be with me in this lectures series, and we will be going through these modules one by one. And the aim is that your transition from preclinical student to clinical students, from preclinical subjects to clinical medicine becomes smooth and successful. Now, I'll briefly give you an overview of what these modules will comprise. The first module, that is entering clinical life, the mind shift, will be having a lecture on from books to bedside, what changes in clinical medicine. And this will include difference between preclinical and clinical thinking, why memorization alone fails, and role of uncertainty in medicine. So the first lecture will cover these aspects. The second lecture will be on the identity of a doctor, professionalism, and responsibility. And this will cover white coat and a doctor, accountability, humility, and lifelong learning. Then doctor-patient trust. The third lecture in the first module, 3 pillars of being a doctor: knowledge, skills, and attitude. Then the second module, approaching the patient. Fourth lecture of the series will belong to this module. And the topic of this lecture will be how to enter the ward and approach a patient. The first impressions, consent and introductions, and cultural sensitivity, Pakistan focused. So we will cover these aspects. In the fifth lecture, which will come under this second module, will be on doctor-patient communication basics, covering listening versus questioning and open-ended versus closed questions and common communication mistakes. So we will cover, inshallah, these topics in this lecture. Then we'll have a third module, history taking. And the lecture in this will be why history is more important than investigations. So we'll cover this. Diagnosis often lies in history. Case-based examples I'll share with you. Then the seventh lecture in the same module will be structure of history taking, simple and logical. And we'll discuss the chief complaints, history of presenting illness, past family and social history. Then the eighth lecture in this module, overall the eighth lecture, but under the heading of the module 3, title will be Pain, Symptoms and Chronology, Thinking Like a Clinician. And we will discuss the Socrates and OPQRST simplified module. Red flags, what do we mean by that? And symptom analysis. Then in the fourth module, that is a clinical examination, seeing patients with purpose. The lecture in this will be first general physical examination, what really matters, vitals, pallor, jaundice and edema, and commonly missed signs. The next lecture will be on systemic examination, why you examine, what you examine, the cardiovascular, the respiratory, abdomen, nervous system, the intro level. Each system will be expanded into its own advanced series, inshallah. Then the fifth module of clinical thinking and reasoning. The lecture here will be how clinicians think, pattern recognition versus logic, differential diagnosis concept, we'll discuss that, probabilities, not certainties, we'll discuss this. Then another lecture will be uncommon mistakes of third-year students, jumping to diagnosis, and over-investigation, ignoring patient narrative. Then the sixth module will be on investigations and reports. And a lecture in this will be when and why to order investigations, supporting diagnosis, not replacing thinking, and cost awareness in Pakistani context. This is very, very important. The next lecture in this module will be how to read basic lab reports clinically, the CBC, the LFTs, the renal function tests, X-ray and ECG basics at conceptual level. Then the seventh module will be on ethics, safety, and attitude. And the lecture here will be ethics in everyday clinical practice. And we will cover the consent, confidentiality, and truth telling. Then the patient safety and your role as a student, we'll discuss that, what you should never do, when to ask for help, and learning from mistakes safely. We'll cover all these topics, inshallah. Then the eighth module will be becoming a better clinical student. And the lecture here will be how to learn effectively in words, case presentation skills, note taking, and asking intelligent questions. Then we will have another lecture, the handling fear, stress, and imposter syndrome, normalizing self-doubt, growth mindset. And then the final lecture we will have in this series, the lecture 19, what makes a good doctor beyond exams, the character and compassion and continuous self-improvement. So dear students, be with me in this series and we will have a journey through all these 8 modules and these 19 lectures. And my attempt is to make you a good clinical student, come doctor at the end of your third year and then fourth year and final year and the whole career of your as a doctor. So I want to give you a good foundation, a solid foundation on the basis of which your career as a doctor shines, becomes stable, become exemplary, and become a mentor for others. So see you in the next lecture, and we will have the first lecture of module number 1. Till then, take care. Khuda Hafiz.